Coming up next, it's the Pulse Radio Show, brought to you with the kind compliments of our friends, MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Pleasant good morning to everyone here with me on Q100.7 FM for another edition of the Pulse Radio Show. I'm Shane Seeley, Communications Specialist with the Queen Elizabeth Hospital. Always good to be in your company every Monday morning from 11 to share with you everything that is happening at your hospital. It's all about trying to show you and basically explain how we are enhancing our services today, over the next 3 years and beyond. We have a great show lined up for you today, and we have a lot to share with you as far as this week is concerned, because it is Antimicrobial Awareness Week. So our infection prevention and control department, they were on Morning Barbados this morning, sharing the word and sharing the work that they are doing in infection control. And as far as AMR is concerned, antimicrobial resistance. So we'll get you a bit more familiar with that term, as one of the highlights today will be one of the leads in the department. That is Dr. Keisha Gustav. She'll be sharing a few minutes with us to tell us what activities we'll be having this week. It's a whole week of activities culminating in what they're calling Blue Friday. So you'll get more details on that to come. Of course, we are going through the 2025 to 2028 strategy, the new strategy for the QEH, led by our Chief Executive Officer, Neil Clark, who's back with us today on the program. Welcome back, Neil.
Thank you, Shane. It's great to be back.
Always good to have you. And we also have, for the first time on our radio show and live with us, our Director of Human Resources, Suzan Reeves. Good to have you on the program as well.
Thank you, Shane. It's also good to be here.
Great to have you,
yes,
because we have a lot to share on the strategy as far as workforce is concerned. You've been hearing right here on the Pulse Radio Show about a number of upcoming employment opportunities at the hospital. We've started to go in that direction with the Ghanaian nurses, the third cohort coming in, but that's just the beginning. It's all about opportunities and enhancing the workforce. Mr. Clark, you under the strategy put in that component about workforce, and you said during this week of activities just gone, which I must mention was a great week of activities as we celebrated our 60th anniversary, and more to come on that. We'll tell you a bit about that as we go down the show. A main component has to be the workforce if we want to enhance the hospital's capabilities going into the next 3 years.
Absolutely. The hospital is all about the workforce. We can't deliver any services without the workforce, so we have to do our best to make sure that we can help them do their job as best as possible. But let me just do that recap if I can, Shane. So we have a new strategy for 25-28. We're just trying to finalise that strategy. We've already had discussions with our staff, and we're taking some good feedback from our staff at the hospital through our town halls in the hospital. We're planning, and maybe Shane, you'll touch on this maybe later in the show, a town hall for the public.
Indeed.
Because I expect the public's wants and needs may differ from the staff's wants and needs from that strategy. And I just remind you that strategy's got 5 components to it. The first and probably the most important is that service delivery. How we deliver the services to the patients so they're effective, they're safe, they're high quality, and then we can pull down the waiting times, we can develop care pathways, and we can give the population of Barbados the hospital service that they rightly deserve. So there's much within the strategy about how we improve and change the way we deliver the care to the population of Barbados. Also in the strategy, there's a chapter on the infrastructure, the buildings and the equipment, and we've spoke previously about the $130 million of capex coming, the new linear accelerator coming, the infrastructure to the Lions Eye Care Centre roof, and the reopening of the 3 theatres in the Lions Eye Care Centre, along with the CT and the X-ray machines for the A&E department. We've got a chapter on financing. It's really important that we're funded by the public, we're funded by the taxpayers here. So it's really important that we deliver value for money and that we have sustainable financial systems to enable the organisation to move forward. Of course, one of my favourite topics is the information management and the introduction of the health information system, which I keep saying will be a game changer and will lead my desire to move us to becoming a paperless organisation. But today's really important because today we're focusing on the workforce. And we have the Director of Human Resources here, Ms. Reeves, who's taken the lead on this particular chapter of the strategy. And within this, there's a number of things that's going to be brought into play over the next 3 years that will improve how we manage and how we support our workforce. And if I hand over to Suzanne, do you just want to give some of those headlines?
Sure.
Yes, Suzanne, before we get into those headlines, CEO, because when we start to get into this conversation on workforce and what that means for the Queen Elizabeth Hospital, I'm sure that you will want to call us. You may have questions about what we're doing as far as that part of the strategy is concerned. 4341007 or 4341070 are the numbers to call. You can also WhatsApp us at 4341007. And remember, I also said we're focusing a bit on IPC as well and the work they're doing as far as AMR Awareness Week. Dr. Keisha Gustav, she's on the line, so I just want her to share quickly a bit about what the week is all about. Another week of activity at the QEH. It has been busy over the last 2 weeks, and we just culminated our celebrations for our 60th anniversary week of activities. That was well attended from the church service on the Monday to the open day on the Wednesday, and the big cake cutting you would have seen at the front page, on the front page of both major newspapers. Cutting in, slicing in to the new strategy was the headline. So that was some good coverage for us. And then on Friday, we really brought it all together as everyone joined on the QEH playing field to really celebrate the QEH at 60 and a lot more to come. And first out of the blocks, as we celebrate and continue to do that, we look at how we are improving our infection prevention and control in the hospital. Dr. Gustav, good morning. Good to have you on. I know you had a busy morning already on Morning Barbados and right here on Q100.7 with the Admiral's Morning Show. So good to have you back with us. Talk to us about the week very quickly. Give us a synopsis of what we are looking at during Antimicrobial Awareness Week. Okay, so we'll try to get her back. So let's go into the strategy and the workforce, and then we'll come back to IPC and Antimicrobial Awareness Week. Talk to us a bit about those highlights. The CEO mentioned a number of highlights that HR has been focusing on under your leadership.
Okay, thank you, Shane. But before we go into the strategy, first I have to thank the staff for their level of commitment, their dedication, always willing, and they go beyond and above. As well, that goes to our engineering staff who ensure that we have all our equipment serviced so that our patients will be given that appropriate care. We also have to thank our finance staff. Those are the ones who ensure that our vendors are paid, and most importantly, that our staff receive their salary on time. Also, the support services, they make sure that we have our hospital clean in all the departments, also medical and nursing staff, and most importantly, the human resources department. Without the human resources, without the
Most
human,
importantly, the Human Resources Department.
yes, because as human resources, we are the foundation of the hospital. Everything that happens in the hospital affects staff. It is us who have to be there to ensure that we allow that type of service to continue.
And just adding on to that, Suzanne, what a great job your team did in helping bring those nurses from Ghana here.
Yes.
An amazing logistical feat in 150 plus nurses arriving, being housed, getting bank accounts, settling in. So well done to you and your team with that.
Yes, thank you very much, CEO. It has been a very intensive recruitment drive. This is our third cohort of Ghanaian nurses, well skilled in areas of A&E, critical care, AKU. So we have a lot of those nurses coming in. Actually, there are about 82 nurses. And actually, the CEO and myself, we just came from the orientation. So they're being oriented this week, and they should be willing to work from this week as well.
Wonderful,
Right?
wonderful.
Yes. So going forward, in terms of our workforce and the 2025-2028 strategy, we are focusing on recruitment and retention. Recruitment, one of the initiatives will be to develop a comprehensive recruitment plan. We have already started that, and we do that through the contractual arrangements with an international recruiter. We do have some challenges in terms of specialties that are available in Barbados, and one of our strategies that we will have coming up will be our career lookbook. This career lookbook is going to be on our website, and this is going to be available so persons can go onto the website, look to see what vacancies are there, and then we will fill those vacancies. I know some persons would indicate that we are always looking internationally to recruit, and what are we doing locally to ensure that we have the locals having a job at the hospital. One of the initiatives that we will be embarking on next year will be the career showcase that we will have at the hospital.
Lovely.
And we will reach out to the secondary schools we would allow for those children to come to our site, so that we will go through those areas where we have a lack of available persons. And these are usually like within the radiography department. On that will be therapeutic and diagnostic. We have issues in terms of our health and safety as well. So all of those skills that we are short of, we would like to go forward with the secondary schools.
There's some real challenges coming up, isn't there? I mean, we're still recruiting overseas for nursing.
Yes.
So we certainly have to work out how we increase the number of students considering nursing as a career, a professional career, a clinical professional in the hospital, with a great way of moving into management. Our chief operating officer is a nurse herself. So there's a management structure, and there's the specialist nurses within there as well.
Mm-hmm.
So we do need to work with the youth of today and identify which of these jobs are future proof. We're always going to need nursing, and we're also going to be needing more health information people moving forward as we get the health information system in. So it's great that we're looking locally to identify with the schools what the future requirements are for the Queen Elizabeth Hospital, so we can help people make the right choices for their careers in the future.
Yeah, it's a thought that I had. I think it's time that the QEH, we continue to engage the Ministry of Health. I already stand on a committee with the school's nutrition policy, but we need to go a step further in terms of encouraging schools to look at nursing on the curriculum at a possibly CXC level. I mean, these are discussions that will have to be had over time. Logistics need to be put in place for that. But there are certain schools that already do that specialty route as far as some other professions are concerned. And with the shortage of nursing globally, it is something that needs to be considered here in Barbados. A thought for the future. And hopefully the right ears can hear, so that we can get a push in that direction. But we are doing what we have to do in the interim.
So in terms of the nursing, I know persons are concerned that Here is it that QEH, and we are actually recruiting nurses from overseas. And what about the opportunity for local nurses? When we recruit these nurses from overseas, do you have jobs still available for the local nurses? And I would like to assure the public, yes, that we do. We were blessed with additional positions for nurses this year, so we do have that availability there in terms of the complement of nursing staff. So there's no need to worry if anyone is thinking that there are no jobs for our local nurses. Yes, there are jobs for our local nurses. So moving on in terms of our recruitment strategy, we are also excuse me, we are also in the process of having a onboarding process which would allow for a buddying system when persons actually come into the institution, so that we do understand what is happening. We've also done a survey, an onboarding survey, which allows persons to tell us, what are your thoughts about how we would have onboarded you? What have we done right? What have we not done right? What would you like to see us doing? So that is going to be one of our next steps in terms of our strategy as well.
Susan, I wonder whether then, if we touched on the recruitment locally and we touched on recruitment internationally, and I know you're developing a new website to help us identify international candidates where we don't have the specialisms in country. So there's going to be a new website there, and I know that we're also capturing from the retention the exit interviews, so we can understand those who leave. Was there something we could have done to have stopped that, and can we learn from that? So I think there's lots happening in regards to recruitment. What about the staff we've got here now, and how we better engage with our staff that we have today? And in that thing, I'm thinking about training and development, well-being of our staff. What have you got in your strategy to support today's staff?
Right. So one of our objectives in the strategy is professional development and training. We are a staff complement of over 2,500 persons. We would have just received an additional post, so that would have taken us a bit over than the 2,500. And one of the areas that we're looking at is to train our supervisors and management level. We have actually started that, and within the training budget, we have a dedicated training budget for our staff, which every year we ensure that all cadres, our staff, do engage in some type of training. We have also done a mandatory training program. We will be revising that also, so that staff will have more interaction with what we are going to be doing. And this mandatory training is also part of our accreditation, where we have to ensure that we are continuing with that accreditation process. So far we have been meeting that, so that is where we will be looking at going forward in the future. In terms of cross-training, we do engage in cross-training within the hospital. We tend to also look at promotion of staff within the hospital as well. Cross-training, we take from one area and we allow persons to go into another area. So you will find that in terms of our nursing staff, we've had a lot of nursing who have actually been promoted out of nursing and into another area. And this is something that we constantly look at, because we have to ensure of development within the hospital.
Indeed.
Right?
And it's something that we've seen recently. I've heard some of the SNOs promoted to ADNS, so we've seen some movement in the system, and it all speaks to improvement of the nursing fraternity. I know that some of them would have gone overseas for additional specialist training. So you're right, HR has been leading the way in making sure that there's training in-house. We've seen a number of our individual staff members getting training, and we will speak to one now who's now Dr. Gustav.
Yes.
She's still on the line with us. So let's welcome her very quickly to talk about this week of IPC, one of the people who has made advancements in her training to really lead the way as far as IPC at the hospital is concerned. And now we are looking at something that has become a buzzword, from the Prime Minister to Dr. the Most Honorable Corey Ford, as well our Director of Clinical and Diagnostic Services, who leads the directorate where Dr. Gustav is working. Dr. Gustav, good to have you on the Pulse Radio Show. Talk to us a bit about the AMR Week 8, I should say Antimicrobial Week of Activities. It's World Antimicrobial Week, and you're raising awareness during the week of AMR. Talk to us a bit about why this is so important and what we're doing at the hospital.
Good morning, Shane. Good morning, everyone. Such an introduction. We are here gearing up for such an important global event, World Antimicrobial Resistance Week. And this year, the week is from today, the 18th to the 24th. And our hospital will be joining international efforts to raise that awareness about antimicrobial resistance, or as some persons may know it as AMR. And we do need your help. We need the public's help in fighting this. Antimicrobial resistance happens when bacteria, viruses, fungi, and those things evolve to resist the medicines that once treated them. And this can make infections harder to treat. It can lead to a longer stay in the hospital and sadly results in life loss. It is a growing track, but it's not too late to act. We are coming together this week to shine a light on this critical issue, and we want the public to be a part of it. Our team this year is Educate, Advocate, Act Now, and during this week we'll be showcasing to everyone, from healthcare workers to the general public, how this role in reducing antimicrobial misuse and fighting the rise of drug-resistant infections. So what you can expect this week: we're going to take you behind the scenes to meet those incredible healthcare professionals who are working together to prevent infections, ensure safe use of antimicrobials, and ultimately save lives. You'll be able to follow along on our website and our social media handles for daily updates, facts, and personal stories. On Friday the 22nd is our Go Blue Friday, and we are encouraging everyone to wear blue. Whether you're at the hospital, at home, at work, this is your chance to show your support for the responsible use of antimicrobial and help raise that awareness about the dangers of antimicrobial resistance. We're going to have also on Friday educational booths and prize giveaways. So come and join us at the hospital along the corridors, where you can meet the antimicrobial stewardship team, and they're going to be on hand to share those important educational materials, answer any questions, and even give out some special prizes. Plus, you will have the chance to meet our AMR mascot. And on Friday as well, because a lot is happening on Friday, we're going to give you the opportunity to bring those unused or expired antibiotics from home. So you just bring them on Friday for safe disposal. We'll make sure that they're handled properly, preventing misuse and protecting the environment. So antimicrobial resistance is that challenge that we all face, but together we can make a difference. We can reduce the spread of infections, improve those patient outcomes, and ensure life-saving antibiotics remain effective for future. So just remember, Friday is Go Blue, so stay tuned into our social media handles and for all those various updates. We're looking forward to seeing everyone on Friday.
Yes, it's great that we have that open door policy so that visitors can come in and share and get a better understanding about why this is so important and needs to be high on the agenda. For you, Dr. Gustav, why do you think that Barbadians need to take AMR more seriously?
We look at the ripple effect. Once there's any kind of misuse in antibiotics, but if you get sick and you come into hospital, when it comes to treatment, that treatment is limited, which means that you're going to stay in hospital longer. And unfortunately, some people may die. So for us, if we can put those proactive measures in place from the beginning, it can stop that ripple effect.
Thank you so much for sharing that with us. As Dr. Gustav said, we will continue this week to send out a number of tips. You can check our social media handles on Instagram and on Facebook, and also on our website for more details. And come into the hospital, you'll see the schedule also posted on our website, so that you can be a part of Go Blue Friday and you'll get all of the information you need. You also heard that reminder to bring in those expired antibiotics into the hospital so that we can safely dispose of them for you. Let us handle the situation for you and get some education at the same time as well. Any final words from you, Dr. Gustav?
You pretty much said it all. You summarized it. I'm just looking forward to seeing everybody in their blue on Friday.
Yes, you'll be wearing blue on Friday for sure. In support of Antimicrobial Awareness Week, World Antimicrobial Awareness Week, as we join our partners from around the world in celebrating at the Queen Elizabeth Hospital and really raising awareness. That's the important part, raising the awareness. Thank you, Dr. Gustav. See you when we
Thank you for
return
having
to
me.
the plant.
All right, bye-bye.
We appreciate your time. So we're back on the workforce, we're back on the strategy, we're focusing on the 2025 to 2028 strategy and specifically how we are enhancing our human resource capacity. Remember, alongside me is the Chief Executive Officer and also the Director of Human Resources. I know you've been waiting to call in, but we wanted to get a number of things handled before we started to receive calls here on the program. So I know Kimberly is lining up something for us. There is a call, and our first usual caller. Welcome, Kamal, to the Pulse Radio Show. What's your question or comment? I know you've called in already.
Yes, Kamal here. How you doing, brother? Good to hear from you, Shane.
Always good to hear you.
Well, thank you very much.
In the batting.
Really appreciate it. Thank you so much. You know what I mean?
The West Indies need you.
The West Indies need me. Well, I need you. I need you, Shane, in being the most critical and crucial.
Not me. Not the most critical and crucial. I am far down the pecking order. I am the conduit. Which the information comes to.
Well, Shane, in terms of being facilitative and in terms of being more initiative, I think that your initiatives in terms of communication to the hospital have made the hospital a better place. I'm not saying that as a cliche. I'm not saying that as a handle. Let me thank the production team for taking my call. I'm saying that in producing what you produce in terms of the communication to the hospital, we as a public are more appreciative of the role of the facilitator in terms of the facilitation of the aspect of how we're able to properly, even with this radio show and the sponsorship, in terms of the increase of the financial support to this place, huh? Yeah. And I thank you. I really got to thank you for that. It's fantastic. It's a brilliant job.
Go
on to Mr. Neil,
Mr. Neil
Clark, CEO. Yes. Go on, Mr. Thank you so much. You see on the ball again. Good morning, Mr. Neil Clark. How are you, sir?
Good morning. I'm good, thank you. And you've made our Shane blush here now.
No. Well, you see, thank you very much. You see, the thing is, Mr. Clark, I was thinking as I was coming on this morning to really admire you and to adore you and to love you, because this is the kind of love in terms of the hospital that we need. When I look and I research love in my Mercer dictionary, I see that love is a strong affection for something, but love is also devotion, care, and support to an institution that has been needing this kind of leadership for a long time now, and we have got it in you. And I want to thank you. I want to appreciate you. I want to love you for the fact that you're doing a bodacious, fantastic, excellent, awesome, or inspiring job. And keep up the good work, huh? You're doing a fantastic job. Keep it up.
Well,
keep it up.
You're making me
keep
blush
going.
too now. But
No. That's not my intention. I'm not Cupid. I don't deal in infatuations, or I don't deal in flattery. No, I'm not involved in that at all. I deal in a real humbleness, a kindness, and in terms of really appreciating the support of what you and Shane are doing. And not only keep it up, but I want it to do more. And I want it to love more this place as we give love to the hospital as it celebrates its 60th anniversary. I want to thank you. I want to thank the hospital for the yeoman service, for the aspect of the support of the care and the love to the public. It really is a blessing, a privilege, and an honor. And I want to thank you for this grandiloquent occasion that you've given to us as a public. Huh? It is fantastic support. I really love it and appreciate it. Thank you. Oh. Now, let me get to my question. What, in terms of the aspect now of the solution to the problem, the only problem that I see, and that is the overrate of the A&E, Can people call before they come, so that you will know to send more support, getting back to the love, sending more love to the A&E so that it can be a more loving environment for those who are waiting for care and those who are waiting for the aspect of now that you're going to get the new CT. My mind is not boggled, it's blown in a very positive way, because the mental health that you're given to this place is so great and so fun, so lovely and loving. You have to send people there, giving them at least an hour to get there, get the retirees there as well, so that when people call before they come, when people WhatsApp before they come, when people email before they come, you would have at least like half an hour with the ambulance as well, so the ambulance calls before they come. And they call you, they call the A&E, they call you Shane, they call you Mr. Clark, and they say, listen, I'm coming. There's going to be a flood of people. We need your help. We need your support. We need your care. We need your love to be able to shower that place with the kind of nursing, the kind of doctoral support, the kind of orderly logistical care that is needed, so that there is not the Shea does not have to do an extra job. He can be paid for his vacation and keep on it. Because, right.
I'll let the CEO answer your question, because I understand where you're going, especially after we had that surge last week. We would have
right, surge, no more.
Yeah,
right.
And that's a part of life, actually.
It's true. You're right.
We have to go to commercial break shortly, so I'll let the CEO answer your question when we return right here on the Pulse Radio Show.
Thank you.
It's a great question, and it's a top topic.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back with you on the Pulse Radio Show with the CEO, Neil Clark, and our Director of Human Resources, Mrs. Suzan Reeves. We're talking about the workforce, but we just had a question from one of our favorite callers, Kamal. Sometimes he's very insightful and gives us a lot of food for thought. He spoke to that number and calling before, like if you're unsure about coming to the A&E, remember there's always that number to call, 536-4800. It's our patient advice and liaison service, also known as your hospital pal, and our help desk. You call, we have medical officials on the line. They will be able to best advise you about your next course of action, whether it be accident and emergency. They can also call an ambulance for you, depending on the feedback they get from you. And they can also direct you somewhere else, because you have options for your medical care. We want you to come to A&E, especially if it is urgent. We are not telling you do not come, but they will be able to advise you on your best and on your next course of action. And you have heard the suite of improvements that have been in train at the accident and emergency department. You know we have an expanded AED, but that does not stop the surges, because you don't know when the surges will come. You get indications and indicators under the new system, which has been introduced by our CEO, Neil Clark. Mr. Clark, you heard Kamal, his question where he was leaning to about the surges, how we manage them and how we're going to handle them going forward. And you've put some indicators into the new system, into the new framework, to help the management of A&E and our staff with doing that, identifying when there could be a possible surge.
Yes, absolutely. So let me start by saying this is probably, you're right, one of the number one objectives is to tackle these long waits in the A&E department. Now, A&E is a tricky place because any delays in A&E are not necessarily as a result of the A&E department. There's many multifactorial things that impact on delays in the A&E, and that could be delays waiting for diagnostics, it could be delays waiting for beds, which might be as a consequence of delays waiting for people to leave the beds, which might be as a result of a surge of patients coming in. So to tackle this, there's a few things that we're doing. Number one, we're putting more staff into A&E. So we're putting more nurses in there, and as Miss Reeves alluded earlier on, some of these Ghanaian nurses are A&E trained nurses, so they'll be joining the team in the A&E department. And we've got some more medical staff being approved in the new posts, so we'll be recruiting more doctors, and these will be senior doctors. These are the doctors who can treat and discharge a patient from the A&E and make decisions directly for a patient, which is really important to keep the flow of patients moving through that department. We've mentioned already about the CT scanner and the X-ray machines coming into the A&E department, which means that there'll be diagnostics done nearer to the patient, which will resolve further delays in transferring patients out and waiting for them to come back down to the department. But it's all about flow, and we can see a surge happening as it happens, and we don't have to wait until we're full to know that the number of patients arriving within an hour is higher than what we normally expect. I have data on the number of attendances by hour of day, day of week, so we know what the normal pattern is, and when that normal pattern changes we can respond to that earlier. To do that, I commissioned an escalation plan, and the escalation plan is being developed right now by the different teams. It's not as simple as me just saying, here's the plan, do it. It's about working with the individual departments across the hospital, and that's all the departments, because every department in the hospital impacts on that flow through the A&E department, to understand what are their trigger points, when are they getting busy, and how will they respond when they get busy. So what actions can they realistically do to support that? And some of these are doing actions which might only last 2 or 3 hours to manage that initial surge. But each of the departments is working through now an action card as to how will they respond if there's a delay. Now that could be a surge coming into the A&E department. How do we respond to that? It could be a delay in the pathology system. Maybe one of the systems has gone down. So we know that that will then impact on the A&E department further down the line. It could be that we're unable to identify any beds for patients to move into. So there's a different challenge there as how we manage the bed flow. So this escalation plan is being developed and should be completed by probably next month, December. We should have the plan together, and then we can start to implement how do we really manage the challenges within the A&E department. That's supported by the additional staff, that's supported by the additional diagnostics equipment in the A&E department, and eventually that's supported by a health information system that allows the A&E teams to immediately access the information that they need to treat the patients. So I just want to say that the A&E team have probably got one of the toughest jobs, because probably they face most of the noise, and often that noise isn't as a result of their work or their actions, it's elsewhere in the whole of the health system, be that people not being able to access services in polyclinics, or be that not being able to discharge people back out to the community, or be that within the hospital itself and the delays within. So this is a detailed escalation plan which will help us improve those waiting times in the A&E department, and I hope that helps answer the question.
Definitely, because we've seen to give an actual update on what the scene was like today in the accident and emergency department. There were three people waiting to be seen. It speaks to the work that Dr. Cruikshank, the head of department, and her team have been doing over the weekend and over the last week to declutter and decongest the accident and emergency department so that things are a bit more manageable, so that we bring down those waiting times, and that those people, urgent cases, definitely those 1s and 2s, we obviously have the triage system which rates patients and their level of illness from categories 1 through 5. Those 1s and 2s are dealt with immediately. Category 3s are not as urgent but still are very sick and may have to be treated. So we are speeding up the wait times, reducing the wait times, so that we can be a bit more efficient and that you can get the service that you deserve. As you heard Mr. Clark said, we're getting that alert system in place, and it should be ready by December going into the new year, so that as a part of the 2025 strategy, you will see these enhancements coming on board. He also mentioned the workforce and those nurses coming into the accident and emergency department. Maybe you want to elaborate a bit more on that, DHR?
Yeah, sure, Shane. In terms of our Ghanaian nurses, we have approximately just over 22 nurses which will be deployed to the A&E department.
Nice.
And they are actually trained in emergency nursing.
22 more nurses into AED.
Yes, so we should have a cadre there that would allow for a smoother delivery. But of course, delivery, as the CEO indicated, also comes from the other departments which assist the A&E in terms of making sure that we do have those persons out of A&E as soon as possible. With reference to the other initiative for the strategy, we are looking at the development and employee wellness program. This is something that we really need to focus on for staff. Our staff, we do work hard. We know that there are a lot of initiatives that we have to look to ensure that our staff are comfortable. We have to ensure that we boost staff morale. And one way in doing this is that we have our committee, that is our reward and recognition and retention committee. To date, we have employee of the month program that has awarded and recognized over 320 employees to date. This is from January to October.
Yeah.
And the other one is scheduled for next week, Friday. So we will have another set of employees who will be recognized for their work within the hospital. We're also looking to look at the mental health first aid program. We do know that mental health is an issue. I am in no way can speak and so address mental health because that's not outside of my forte, but we do know as a human resources department that it affects our staff, and what we're looking to do to ensure that we have persons trained in that area as well.
It's really important that, Suzanne, because since I've been here, I did my first aid training, Heart Saver course, and it's good to do that. It means that I can save somebody if they have an accident, and hopefully help save a life. But what we don't do here is mental health first aid, and I'm used to seeing an organisation where we prioritise mental health and mental well-being of the staff as much as we do the physical well-being of our staff. So I've asked Suzanne to have a look at, can we bring in a mental health first aid course where we train up a number of staff within the organisation to be mental health first aid responders. And what that means is that anybody who's feeling a challenge, mentally challenged, burnt out, whatever, they've got somebody they can go and speak to, and they'll know who these people are. And that's about our staff supporting themselves. But in addition to that, I think, Suzanne, you've got a referral pathway for those who might have more complex or complicated mental health needs. And in a hospital, let's be really clear, in a hospital, you will see some things which are challenging. It's not an easy job, and it doesn't suit everybody. So we have to help support those staff who've got the burnout or have seen something that was challenging to them, and it's really important that we put in place systems to do that. So the referral systems that we've got for the staff, or that we're going to develop for the staff, Suzanne?
Yes, so in terms of that referral, we do have an employee referral program, and this looks at assistant employees, whether it's a personal issue that they're having, substance abuse. We are very good at accommodating staff. We do have staff that we do have to accommodate at times when they're unable to engage in the duties that they were employed under their portfolio. We allow this to happen. So as a health institution, we have to ensure that we give staff the opportunity to improve themselves. So when they're having those challenges, so we do that for staff, and that helps. And we have seen great improvements in staff who would have gone through this program, and this is something that it is something that we do, but it's not something that we know that is basically out there and people speak about it, because though that type of action is very personal and very confidential.
And still taboo somewhat within our society.
Yes.
Very much stigmatised still, I think. And having mental health first aiders in the organisation, our staff, helps them understand better what mental health is, and helps them accept that it's no different than a medical health condition. So we shouldn't be afraid of talking about mental health, and we should absolutely be putting more in place to support people with such challenges.
Yes, it's all about support across the board, especially as far as mental health is concerned. It's no longer just a buzzword, but something that people put as probably their number one priority, because it is needed for a balanced life and a balanced workplace, a balanced operation as you go from your day-to-day activities altogether. You need to have your mental health in order. Let's go to the phone lines. We have some callers waiting. Welcome to the Pulse Radio Show. What's your question or comment?
Good morning.
Yeah, please, before you start, turn down the radio. You can listen to us here on the phone.
You can hear my radio?
Yes, I can. I can hear myself.
I'm sorry.
That's
Shane.
okay. That's all right. I know my voice well. That's all. So I heard it in back row.
No, sorry. I'm sorry. Just a second.
No problem. Yeah, so as you on the call to turn down the radio.
Is that good?
It should be. I'm not hearing myself anymore. So you can go ahead with your question or comment.
I had it just on listening.
And I thank you for doing
the
that.
end part.
I thank you for doing that. It's good that we can share the information with you. But go ahead. Don't let me stop you.
Good morning to you, and is it Mr. Claw? I didn't get the name of the lady.
Yeah, that is Director of Human Resources, Mrs. Suzan Reeves.
Okay, that's Suzan Reeves. Okay.
Reeves, yeah.
Reeves. I think I know who it is.
Okay.
I had called before concerning some appointments that I was getting cancelled.
Right.
So this is months now that I haven't. I did call the number. I'm very familiar with the number that you give out.
Yeah, 536-4800.
Yes, that's right. I can tell anybody.
Yes.
I've told quite a lot of people.
Thank you.
And you're welcome. We all have to help one another. But my problem is I really need to get to these appointments in order to better my health, and especially so I can walk.
Yeah.
And getting there is a problem because of the disability bus. So I can't call, even if I get an appointment today, I can't call them and tell them to come to me today. So most of the time...
Yeah, because you need time to prepare. And then if they push back the appointment, it may be too far.
Definitely. If I get one, mine is probably going to be next year.
All right. So this is what I'll do for you. Please, I want you to leave your name with the producer today. If you have before, do that again today. And we will follow up on that today and get back to you. And I want you to, when we do that, call us next week and let us know about the process, how it was for you, if it was difficult, if it was easy, so that we can address it going forward.
Okay. Is something wrong with the ultrasound department? Well, I asked because doctors had made 3 appointments for me there, and the lady, Miss King, that's there, she called, she had given me her name. It's very pleasant. She told me they are canceled on the same day.
The
and I said, why are you canceling my appointments? You know, I've been there and gone for X-rays, and I've seen other people go into the ultrasound, and mine is urgent for what I need.
Right.
So I don't know why they keep canceling.
Talking about radiology, I believe.
Yes, please.
And we're still, everything is still operational. The department is functioning as normal. So for us to handle your concern, as I said, you just leave that name, and we will make sure that you get your appointment and that your concern is addressed. And we want you to, never be afraid as you're doing now. Come back next week and share with us if the process was good, if the process was bad, so that we can best address your concern, because your concern might be shared by others as well.
And it's really important because...
Okay, thank you so much.
Mr. Clark is adding to what I said.
Yes.
You're raising a concern here that we obviously need to go and investigate, because I'm not aware that there is a challenge in that department any more than normal. So not hearing the feedback makes it really hard for me to go and investigate. Is there something happening that I'm not aware of? Is it something
That
we
is
need?
what I've asked,
Yes.
because I am not making them. The doctors are making them, and then when I do get ready, I get a call from the lady telling me it's cancelled.
So if we get your details, as Shane said, we can go back and have an investigation as to what happened there. So let me just add on to that as well, because I hear a number of complaints coming in about waiting times for the outpatients and even for the inpatients or cancellations. And these are equally important as the A&E wait, and clearly they're in the strategy for next year. And clearly they will be significantly supported when we have a health information system, so we can track the waiting times and see where each individual patient is up to on that pathway. So it's really important, though, that we capture the feedback from yourself and from others so we can investigate that. And I also want to make sure that when we capture the feedback, that we respond in a timely manner, that we respond to that feedback. So we'll be doing some changes, and we'll discuss this at a later radio show, on how we're going to enhance and improve our quality department, which includes the patient complaints, so we can get a better tracking on as each complaint being managed and handled effectively. But let me put this into context. We've only received so far this year about 250 complaints. Each and every one of those complaints is really important to me, because that allows me to go and understand that somehow we've gone wrong somewhere. I'm really sure that there would have been many more than 250, and some people didn't even put a complaint in.
Yes.
But when I looked at the number of complaints against the number of activities we've done, that's only 0.02% of all the activity we've done. So the vast majority of the times we are getting it right, but on a number of occasions we're not. And just because the
really
number's small, it doesn't matter that the number's small, because that was a bad experience for you, and we need to understand, why did you have a bad experience, or anybody else who put a complaint in, why did they have that bad experience? So we do welcome the complaints. I actually personally think we don't receive enough, and that might sound strange. I would like to hear more. People shouldn't be afraid to complain, and they should understand that if I receive complaints, we can understand better where we're failing the patients. So again, thank you for raising that with us. Do leave your details behind, and we will have a look at what happened in your particular case.
Thank you, sir. Thank you. And you do have a good week.
You're most welcome. You're most welcome, and thank you for again tuning in and calling here on the Pulse Radio Show. This is your avenue to not only make those complaints, but offer suggestions on how we can improve our services. And as the CEO did mention, we'll be having that public town hall, a public consultation very soon. It is slated for the 27th of this month, and we will be holding it at home in our QEH auditorium. So we want you to come in. The time will be 6 p.m. Come in on that Wednesday, the 27th. I think that my scheduling is right there. Sometimes I have to look back at the calendar because I do get these dates wrong. So that's next Wednesday, the 27th of November, 3 days before Independence Day. You come to the auditorium at the Queen Elizabeth Hospital, and you'll get to hear and see firsthand the 2025 to 2028 strategy, and we want your input. The CEO has made this mandatory for us to gather your input, gather the information from you, so that your ideas and your proposals can also feed in to this new strategy as we go forward into 2025 with enhanced services, better equipment, better staffing, a stronger workforce, and more to come. We have another caller here on the Pulse Radio Show. Only 6 more minutes to go, actually. What's your question or comment? An hour flies so fast. Caller?
Hi, morning.
Hi, morning. How you doing?
I'm good. No, I do notice I got a serious problem, and I don't know how you go about it, but you can tell me, no. If you had an operation, I had a problem, that the doctor should rectify the problem.
Well, that should be the case. The doctor should be able to be the best guide in terms of rectifying the problem.
In my case, clearly he wasn't. I had an operation. I need to sleep mostly on my stomach and something my side. By the time I get the operation, I can't. If I lay down on my stomach, my back killing me. I can't sleep on my side. I go a term. I can only sleep on my back.
Wow. When is your next appointment?
That return, I go everything that finished. But the thing that had me really vexed about that, I was going attending the hospital in between. I saw the doctor. Can I call his name or no?
No, you could leave that out, but we could get your information when you before you go, because we want your information to follow up the case, so that we can make sure that we do better by you.
Yeah. Okay, well, I went to the doctor. I went to the hospital. I tell you, Mr. Smarto, I have a problem. Since you do the operation, my back is killing me. I can't sleep from my back. But you should go to a doctor for what. Sir, you is who did the operation, so I got to come to you. You know, the doctor look at me, stoops and walk there.
No, that's not what we want to hear at all.
Believe it or not, I said, look, this is why people do this something. I could not believe he actually look at me, stoop and walk away. But you know, he will come now and tell you it's not true. I come home, I tell everybody about it. I was really annoyed about it.
Well, listen, thank you for sharing that concern, but we want to get to the bottom of your problem. So you have two options. We want you to take both, actually. Leave your details with the producer so we can follow up with the case. And you can also call that number that I would have shared before, 536-4800, and share your details with our medical team so that we can either get another appointment for you or see how best we can address your pain and your concern going forward. Okay? So 536-4800, and please leave your details with the producer so that we can also probably reach out to you. Leave a contact number so we can reach out to you and have that follow up for you very soon. Okay?
Okay, thanks very much.
No problem. And thank you for sharing here on the Pulse Radio Show. See, anything you want to add to that?
Yeah, so just again, it's really important to get the feedback so we can investigate what's happening. And we're talking here about, obviously, feedback from the public of some concerns that they've had. And we do have a complaints process which allows us to investigate and to learn from that. So we do appreciate and encourage people who've had a poor experience to let us know, in the same way we encourage those who've had a good experience to also let us know, so we can pass that back onto the staff. And today we're here talking about staff, our workforce, and I know we're talking about consultations. We as the leaders don't necessarily know everything, and the staff know much more about their areas than what we do. And I understand then, Ms. Reeves, that we've got a workforce town hall coming up shortly. Do you want to tell us a little bit about that?
Yes. So our workforce town hall will be on the first Thursday in December. I think that's the 5th of December, Shane?
Yeah, a couple of days after my dad's birthday.
Okay. And we will be focusing mainly on the workforce. We want to hear from staff. We want to hear from staff in terms of what are the best ways to communicate with you. We would have done 2 staff satisfaction surveys within the last year, and one of the issues that came up that we need to address were the communication aspect. We've been trying a number of activities to address this. One area is the town hall, where we meet with staff on a regular basis, but we want to hear from staff, especially for this particular town hall, so that they would indicate to us, hey, we tried this, but is it working? Is it not working? So we need to hear from staff in terms of that. We will also be looking at our staff in terms for discounts for staff. This is something that we need to get going. We are the largest employer in Barbados, over 2,500 staff members, and I'm sure there's some agencies out there who will benefit from clientele in their portfolio. In terms of our cafeteria, we are looking to make sure that that becomes more comfortable. We have persons who work within the hospital constantly, 24/7, and we have to ensure that that facility is comfortable for staff. So that's what we're looking at as well. In terms of the CEO spoke about the paper-based issue that we have at the hospital.
I'm moving away from the paper.
Let's lose that paper.
I'm moving away from there. I must say to you that the HR department is a paper world. We have lots of paper going on in the HR department, and one of our initiatives is to ensure we get to the human resources information system.
Nice.
And this is going to be very helpful for staff, even in terms of someone wanting to know how much vacation they have. Staff actually have to call the human resources department to find that out. In terms of applying for that vacation, you have to call or you have to come. So when we have this HRIS system, it will be self-serving. So we won't have that interaction in terms, not that we don't want to interact with staff, but the process would be a lot smoother and a lot quicker.
And I think this would be really helpful for the staff. A staff portal where they can see their leave, see their pay statements, see what training they've done, see their last appraisal, put in a grievance if need be, and track the grievance through the system. So I think this will be really beneficial for the staff in a way of being able to see and communicate with the HR faster.
Yes, I really want to thank both of you. As you know, this time flies fast, but we leave our audience wanting more from us, and more will come from HR, from our CEO, from all of the departments at the QEH right here on the Pulse Radio Show. I want to give you one other quick number that you can call. Remember, the PBX is working again. We've sorted out an initial challenge that we had with our numbers at the hospital. You can call our PBX 436-6450, and as the CEO said, please send your complaints to the clinical risks department. The extensions for those that department 5234. That's simple. That one is simple. 5234, 5247, and 5248. And you can call between 9 in the morning and 4:30 in the afternoon. And also remember our patient advice and liaison service 536-4800. You can call that with any query or information that you want to share or find out. And if it's about the A&E, you can call that number as well. Thank you for being a part of another edition of the Pulse Radio Show. On behalf of the CEO Neil Clark and my DHR Suzan Reeves, I'm Shane Seeley, signing off until next week, where we'll have more information about your Queen Elizabeth Hospital.
Thank you so very much, Shane. Of course, the Pulse Radio Show brought to you with the kind compliments of MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.